I'm glad to have y'all today. I am one of the registered nurses that works here in Newborn Follow-up. So the day you go home with your baby, you will get an appointment to come back in either 1 or 2 days, and that is determined by your pediatrician to come back and see us. We are here at Women's Hospital. We get the babies back and we will talk to you a few minutes, make sure you're not having any problems, or if you have questions, we will ask you about feedings and voids and stools. We will assess your baby, get your baby's vital signs. We will weigh and also check your baby's jaundice level also. So you'll come back through the front door. You will stop at the security guard, get a visitor's pass. Also, they will check your temperature when you come through the door. Then we'll need to make our way over to the admissions desk. So the lady at the admissions desk will check you in. She'll also give you a pink sticker to put on your shirt, and that's a security sticker while you're here. We know where you're going straight to follow-up. She will also let you just sign some paperwork, and then you will just be sent around to Newborn Follow-up. Probably the most frequent question that we get is, why is my baby sneezing so much?
Bless you.
And that is normal for a newborn. That's really how they blow their nose or they clear their airway. So that's actually a good thing that they do. But as parents, sometimes we wonder if they're getting sick. So that's very normal. Another thing that we see a lot is newborn rash. So that may happen in the hospital, that you notice your baby has a rash, or it may be after you go home. So a lot of times it looks like just a little red rash, but it can look like a little white pimple or a little white bug bite. And sometimes parents tell me, I think a mosquito's bitten my baby. But that's just newborn rash. That's normal. Eventually will go away. Another thing that we check when you come back will be the baby's cord. We like to keep that cord dry. And usually in about a week to 2 weeks that will fall off. If you have a little boy baby though, sometimes they, as you know by now, TT on everything. So sometimes they wet their cord, they TT on their face, everywhere, mom and dad. But if the cord gets wet, or if the little boy babies have a circumcision, and as you're applying that Vaseline, sometimes the Vaseline will get on the cord. So if you notice the cord is wet, then get some alcohol and go around it. Otherwise, you really don't have to do anything to the cord. Just keep it dry. We'll also check if you have a little boy baby and you did choose to get a circumcision, we'll also check the circumcision. Now, you will see 2 different types of circumcisions. It depends on which OB doctor does your circumcision. Prenatally, as you're visiting your OB doctor, that is something that you'll need to arrange for before the baby's born. They will ask you about this at the OB doctor's office, so you'll need to talk to them about getting a circ after your baby's born. Some of the doctors use what is called a plastibell, which is just a little ring. You will see that on the penis in about a week to 2 weeks that will fall off. You'll know after that time that the circ is healed. We'll check that. The other one is called a gomco, and in that case you won't see a ring. It would just be just the little circumcision. A lot of parents come in and they ask me, I need you to look at my circumcision because I think it's infected. It has a lot of yellowish white stuff all over. It looks infected. I understand that it really does. It does have a lot of the little healing tissue, but that is just a granulation tissue, a healing tissue that will slough off on the diaper. And in about a week to 10 days to 2 weeks, that will be totally healed. So yes, it does look like it's infected, but it's really just granulation tissue, and that's very normal, but it's scary when you see it. Also, you may see in the first week or so a lot of dry skin on your baby. Your baby may look like it's peeling. That's normal. That will eventually resolve. The other things that I hear is my baby's hands and feet are very cold and purple, bluish and purple. That's called acrocyanosis. That is a normal finding in a newborn, and that also in a week or 2 will resolve. If you have a little girl baby, you may notice a vaginal discharge. It can be, most of the time it is a little white discharge. Sometimes, though, you will see a little bit of a bloody discharge, and that's very scary to parents sometimes, but that is normal finding. They also, down in their little private girl parts, may see in the labia, you may see some swelling and some redness. That is also normal. All of this is due to hormones, and in about a week or two, that will be gone. Um, the other thing we will check when your baby comes to follow up, and you'll notice that they check this at nighttime. This is the bilirubin meter, so they will check this on the baby's chest, on the skin. It's not invasive. They will check that while you're here with your baby in the hospital, but we'll also check it again when you come back. So most babies, this is very normal, but occasionally we have a baby that the bilirubin is too high. In that case, we would go to the lab. If this meter is reading high, we would go to the lab and we would have to do a heel stick on your baby, and we would find out the results in about 15 minutes. So that might make your visit just a little bit longer. And if it was too high, we would call the doctor, the pediatrician, and find out what we needed to do about that. You will hear in the hospital, we'll hear this over and over, watch your baby's hunger cues, usually the hands to the mouth, crying, can't lay them down, can't swaddle them, they get out of their swaddle. Watch the baby's hunger cues and feed to the cues. If you are breastfeeding and you're having any problems, when you come back to newborn follow-up, we can call, we'll do your assessment first, but then we can call a lactation consultant to come down and assist you. We've got a private room we can put you in, and they can help you with any problems that you're having. I wanted to show you too, if you're bottle feeding, watch your baby's hunger cues, but even with breast or bottle feeding, if a baby goes over 4 hours without eating, you need to start waking the baby up, and that can be just gently starting to change the diaper. You may have to take their clothes off, but after 4 hours the baby does need to eat. They don't need to go over at that point. But I wanted to show you a lot of the issues that I have in newborn follow-up are if you're bottle feeding or if you were pumping and putting your breast milk into a bottle. A lot of times when you go home, you've used our bottles here, but then you change to another brand, which is totally fine. But we have found that a lot of the newborn bottles and nipples flow really, really fast. So sometimes you have to experiment with your baby and see what works for them. If you notice that your baby seems like it's taking the milk too fast, sometimes they'll be gulping the milk, they'll choke on it. You'll also see maybe sometimes it runs down their chin, and you're thinking they sure are taking this feeding in 5 minutes when it maybe should take 20 minutes. So I want you to really be able to get out, put your milk, whether it's breast milk or whether it is formula. And I've got two different nipples here. This one is a little bit faster flow and the yellow one is a little bit slower flow. But any bottle that you have, any brand that you have, put your milk in there and turn it upside down over the sink, and you can see this was dripping about every couple of seconds. And then when we go over to the slower flow, we're going to see what it does. We can get it started. And you can see it's dripping fairly slow. A lot of times when moms and dads come in, I'll ask them, do you have your bottle with you? And then I'll take it. And when I turn it upside down over the sink, it is like going drip, 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 just very, very fast. Then we know that that is too fast for a newborn to accommodate. And that's when you're going to notice that your baby may be gulping the milk. They get a lot of air from that too. So you may notice that they have a lot of tummy aches and gas. Gas is a normal finding. A lot of people ask me about why my baby has gas, but gas is normal. But if they're gulping air, they're going to have a lot more gas. You may have a little bit more of a fussy baby. So if you have a 2-day checkup, but let's say that will be usually day 4 of life for the baby, but let's say on day 3 that you're starting to have issues. Maybe the baby's not eating well. If you're breastfeeding, your baby won't latch. And I want you to watch for the wets and the dirty. So let's say your baby's not having many wet diapers, it's not having any dirty diapers on day 3. You know you're not supposed to come back to the next day. I want you to call me that day. We will provide you the number when we make the appointment. Usually that's a warning sign for us. Or if there's other things that you just need to call and ask questions, our number is on that appointment sheet. Now truly, if you are having a true emergency, you would need to call 911. I certainly would not want you to wait till we're open the next day. But those questions, and even if you're just not sure if you should call, go ahead and call us and we can reassure you. If you need to talk to lactation, she can talk to you also. So after this visit, the 2-week checkup with your pediatrician will be the next visit. You will need to call and make that appointment yourself of your pediatrician, of whoever you choose. Really, we just appreciate everyone viewing this. We're glad that you're going to come here and have your baby. We're going to be very happy to see you in Newborn Follow-up. The main goal of follow-up is to weigh your baby, to make sure your baby's weight is starting to gain weight and is adequate. And we know that the jaundice level usually peaks somewhere between day 3, day 5, and sometimes for preterm babies a little bit after that. So we always just want to make sure that we're getting every baby back and checking and making sure there's no problems.